Zenith Care is a health facility in Nanyuki that offers outpatient services. The reason why we came up with Zenith Care is because we realized that 60% of the peri-urban population does not have access to health services. And this is not just the poor people who don't have facilities, but even those with the ability to pay do not have quality and affordable services. So for some time we were doing medical outreaches to nomadic pastoralist communities using different donors, but we realized we couldn't sustain it. And we found that you find a donor who is interested in one program, for example HIV, and they dictate it has to be HIV. So we sat back and we said, okay, what can we do that, one, it is sustainable, we can raise revenue. Two, there's follow-up for the same clients, because you don't do an outreach in a village and then you disappear. There's a lot of follow-up that you have to do. So that is the premise from which that we came up with Zenith Care. So Zenith Care works by having a corporate arm which generates revenue by providing health services, and then 30% of that revenue goes into providing medical services to the nomadic pastoralist community at the household. Our focus is maternal and child health, so we've been able to offer antenatal services, we've been able to deliver babies at the community, and we've been able to have immunization for children, because we believe that how you're brought into the world and the first 1 year, the care that you get within 1 year changes your life by far. So that is why you may find that we are very focused on MCH, because that is something that you don't choose to do. Having a child is part of nature and it's the most natural thing, so you shouldn't suffer while doing it. The vision that we have for our organization is to set up a culture that goes beyond us as the founders. So right now we are the vision bearers, but we all know that you don't live forever. For us, it's building a legacy. So our vision is whereby even as you carry out your corporate, there is a social responsibility for those who don't have the means and the ability to have such access to services. So our vision is to really narrow down on our target, both at the corporate level, but even for the community. So we want to have a street children program where we offer food programs, we do rehabilitation, and make them reintegrate back into the societies. We also want to take up mental health, because I believe if your mental health is okay, even if you don't have money, you will make something happen. But even if you have the best, but your mental health, where you are mentally, the belief that you have in yourself is not 100%, then you will not be able to achieve those things. So that is the vision that we have. The challenges that we've had is most organizations do not have the kind of structure we have. So either someone is simply a social impact organization and they look for resources from other organizations and carry out projects. But to find an organization where you're generating resources, the same resources you use for social impact, it's a conversation that is very hard to have with people. So the fact that it's a limited liability company, people say that's about profits, but it's about sustainability, it's about independence. Because if you look at healthcare, almost 80% of the health financing in our country is donor dependent. That is why they dictate what programs to carry out. So we hope to be able to get there. And another thing is having employees who understand both sides, that despite making money, are we making an impact? So that is what for us has been the biggest challenge. I do have a bit of business background because of the MBA that I did in healthcare management. And one thing about business, it's about external, it's about the client. Is the client happy? Are you marketing? Do you have strategy? But I feel that the YES program will give me an aspect of introspection. As a leader, am I doing this with genuine reasons? Am I able to carry this vision that people do not have and be able to have buy-in from the people? So what I love about YES, it's how it focuses on you as the entrepreneur, but also integrating your team, integrating the beneficiaries that you're working with. So that 360 that YES brings to the table, that goes beyond business, that goes beyond the bottom line, is what I'm very interested in here. Yes, Africa. Yes, you can.